Welcome to Module 4, the final module of the Early Start Leadership Project. In this video, we'll look at the schedule for quarterly ICC meetings and what you can expect when you participate and attend, as well as taking a full look at the two-day meeting agenda of ICC meetings. But first, let's review what we've learned so far in our training. Thus far, we've covered the important role of parents and providers in the disability movement, the history of IDEA, specifically Part C pertaining to early intervention services, California's unique system of regional centers, the development of California's Early Start program, the establishment of Early Start Family Resource Centers and the formation of the Family Resource Centers Network of California, why open meeting laws and Robert's Rules of Order are important to public participation, the difference between laws, regulations, and policies, where to access Early Start statutes and regulations, how to become active in local Early Start activities, how to participate in the state ICC as a governor's appointee, community representative, or member of the general public, the value of communication styles, especially when serving on councils or committees, tools for documenting life skills and accomplishments, and the value of sharing lived experiences and telling your story. We've also gone over several ways that you can become involved in creating Early Start policy, including attending virtual and in-person meetings of the state ICC, even if it's just to listen and learn, providing public testimony about your lived experiences, either virtually or in person, applying to become a community representative, applying for a governor's appointment to the state ICC, learning about local Early Start activities and participating at the local level. Now let's turn to some facts about ICC meetings themselves. ICC meetings are held quarterly, 4 times a year. Meetings are typically held for a full day on Thursday and a partial day on Friday. All meetings are open to the public in compliance with the Bagley-Keene Act. Meetings are held in person, and participants may attend via web conferencing. Meetings are often held in Sacramento, though they are sometimes held in other locations throughout the state. This provides the opportunity to hear from diverse local communities. To encourage participation, new members are invited to have a mentor or designated person to help orient them to the meeting format, make introductions, and feel welcomed. Translation and interpretation accommodations are provided upon request, as long as the request is made with at least 14-day advance notice to DDS ICC support staff. American Sign Language and Spanish interpretation are typically provided. The ICC page on the DDS website has more specific information about meeting dates, previous meeting minutes, travel guidelines, bylaws, and the roles and responsibilities of appointed members and community representatives. Members and representatives may be reimbursed or receive advanced funding for travel to ICC meetings through DDS. To learn more about travel reimbursement or any information about ICC membership, contact the Early Start Policy and Operations Branch of the DDS at 800-515-2229 or earlystart@dds.ca.gov. Travel reimbursement is not currently available for the general public. Now that you know when and where ICC meetings are held, let's take a look at what happens at the actual meetings. We'll be going through an entire meeting agenda. Day 1 is often called the Working Meeting Day. The focus is on special presentations related to Early Start, young children, families, research, and new programs, projects, or trends in the field. Members of the public viewing via web conferencing can add their names to the meeting notes by providing them in the chat. The ICC chair opens each meeting with a welcome and roll call of governor-appointed members. Updates are provided by DDS and Voices from the Field. This includes updates from the Family Resource Centers Network of California, the Infant Development Association, the ARC of California, and the California Disability Community Action Network. In compliance with open meeting laws, there is a specific time set aside for public input, which will be noted on the meeting agenda. This is done so that even if someone cannot attend the full day's events, they will still know when they are able to offer their input and testimony to the meeting's members. There is typically a break in the middle of day 1. Following the break, 2 ICC committees convene. The 2 ICC committees are Communication and Outreach and Improving State Systems. There are several subcommittees within the Improving State Systems Committee related to families and children and other issues of significant concern. These committees meet until the end of Day 1. Day 2 is a half day, typically starting at 9 a.m. and adjourning by 1 p.m. Just as with Day 1, the meeting begins with a welcome from the ICC chair and roll call of the governor-appointed ICC membership. The next thing on the agenda is ICC member reports. Updates are provided from all ICC state agency representatives, including the Department of Developmental Services, the Department of Social Services, Indian Healthcare, the Department of Healthcare Services, the Department of Education, Special Education, and Homeless Education, the Department of Managed Care, and Head Start. After the agency reports come committee reports, and, once again, a specific time to allow for public input. The meeting ends with a recap of events and closing remarks by the ICC chair. Your voice matters. Remember, the role of the state ICC on early intervention is to advise and assist the California Department of Developmental Services on California's Early Start program. In order to ensure that Early Start is implemented in a way that reflects the intent of the law for all eligible children and their families, it is essential that the rich diversity of California's families are represented. The ICC wants to hear from families, providers, and all interested parties about Early Start activities and its impact on infants, toddlers, and their families. The goal is continuous quality improvement to enhance early intervention services to all eligible children throughout the state of California.